A major H-1B fee fight is now moving into Congress, and healthcare is right at the center of it. Curious. A bipartisan group of lawmakers has introduced a bill that would exempt physicians and other healthcare workers from the Trump administration's $100,000 H-1B fee. That matters because for hospitals, clinics, and workers already dealing with shortages, a fee like that can change hiring decisions fast. By the end of this video, you will know 3 things: what the proposal would change, who it could help, and what to watch next so you do not get caught off guard. Thoughtful. Here is the part most people miss. This is a proposal, not the final answer. So the big question is not just what was introduced, but how far it can actually go. So what changed? In simple terms, lawmakers introduced the H-1Bs for physicians and the Healthcare Workforce Act in the House. The goal is to carve out an exemption for healthcare workers from the new $100,000 H-1B fee, and to block any new H-1B-related fees for those workers that would go beyond what current law already allows. In plain English, that means the bill is trying to protect hospitals and health systems from being hit with a huge cost when they hire doctors and other critical medical staff from abroad. This is especially important because the H-1B program is one of the main ways U.S. employers bring in highly skilled workers in fields like medicine, tech, and engineering. Myth versus reality time. Myth: the fee is already gone for healthcare workers. Reality: not yet. The bill has been introduced, but it still has to move through the House process. Another myth: this only matters to big city hospitals. Reality: rural hospitals, community health centers, teaching hospitals, and specialty clinics can also be affected, especially where staffing is already tight. Now, who is affected? The clearest group is physicians and other healthcare workers tied to H-1B petitions. That can include international medical graduates, certain clinical specialists, and some workers in hospital systems that rely on specialty labor. The brief also points to roles like clinical laboratory staff, which helps explain why the issue is wider than just doctors in white coats. Who may not be affected? People outside the healthcare sector would not benefit from this proposed exemption. Also, if someone is not on an H-1B pathway at all, this bill would not suddenly change their case. Another important detail: if your employer is not in healthcare, this proposal likely does not help you. Here is the key distinction: the bill is aimed at specific healthcare workers, not the entire H-1B program. Example scenario: imagine a rural hospital trying to recruit a specialist it cannot find locally. If the employer has to weigh a very large fee on top of normal hiring costs, that job offer may become harder to make. Now imagine a teaching hospital that depends on international medical graduates to fill gaps in residency or specialty staffing. For them, a fee exemption could mean the difference between moving forward and pausing hiring plans. That is why hospital groups and medical organizations are backing the measure. They say it could help preserve patient access to care and reduce the risk that hospitals simply cannot afford to hire the people they need. Why is this happening now? Because the Trump administration's new H-1B fee is being framed as a way to tighten control over the program and push employers to prioritize American workers. Supporters say that helps reduce misuse. Critics say it can worsen shortages in fields that already struggle to recruit. And here is where the policy tension becomes clear. Immigration rules are not just about paperwork. They can directly affect whether a hospital has enough staff to keep services open, especially in underserved areas. So the debate is not only about immigration, it is also about workforce planning, patient access, and how much a shortage costs when the people who feel it are patients. Myth versus reality again. Myth. If a fee is high enough, companies will always just pay it. Reality. Some employers can, but many smaller systems cannot. And even large health systems have budget limits. That is why a fee can have a real choke point effect. Another myth. This is a final policy shift. Reality. Congress has to act, and then the details still matter. Real-world consequences could show up quickly. For applicants and employers, the fee can affect whether a petition is filed at all. For hospitals, it can shape recruiting timelines and staffing gaps. For families, that can mean longer waits for appointments or slower access to specialists in communities already dealing with shortages. And for workers, especially international medical graduates, this can create uncertainty about whether their U.S. job offer will go forward on schedule. One more thing to watch. If organizations delay hiring while waiting for Congress or agency guidance, the slowdown itself can create a backlog even before any new rule takes effect. Example scenario. A hospital has 2 candidates for a hard-to-fill role. One candidate is domestic, but the other is an international physician already trained for the specialty. If the cost structure changes too much, the hospital may change course, even if the international candidate is the best fit. That is the kind of decision this proposal is trying to influence. So what should you do now? Do this. First, confirm whether your case or job offer is actually in the healthcare category described by the proposal. Second, save copies of any employer letters, petition notices, and filing receipts. Third, monitor official updates from USCIS, Congress, and your employer or immigration counsel. Fourth, if you are a hospital or health system, review hiring timelines now rather than waiting for the last minute. Avoid this. Do not assume the exemption is already approved, and do not cancel or rush a filing based on rumors alone. If you are an applicant, keep communication open with the employer so you know whether plans are changing. If you are a healthcare worker, this is a good time to keep your documents organized and be ready to act if the rules shift. Here is the part people often miss. Even when a bill sounds targeted and bipartisan, it still has to survive committees, floor votes, and possible changes along the way. And that means what is introduced today may look different later. What happens next? The bill now goes to the House for consideration. Lawmakers will review it in committees before any possible floor vote. At the same time, there are other moving pieces in Congress too, including separate efforts to roll back H-1B restrictions or even eliminate the program entirely. That does not mean any one of those ideas will pass. It just means the H-1B fight is not isolated. It is part of a much bigger debate over skilled immigration and labor shortages. Watch for 3 things next. Whether committee leaders take up the bill, whether the language changes to broaden or narrow the exemption, and whether agency guidance starts to clarify how the fee is being applied in practice. Also watch for court challenges or policy adjustments if the fee continues to reduce applications or creates unintended staffing problems. The numbers already suggest this policy is having an impact, since reports indicate new H-1B applications have dropped sharply, and the federal government has collected far less in new fee payments than expected. That does not prove the policy will change, but it does explain why the issue is getting attention fast. Myth versus reality. One more time. Myth. This is only a political talking point. Reality. It is already affecting real hiring decisions, real budgets, and real workforce planning. Myth. One bill will solve everything. Reality. Even if this exemption passes, broader H-1B debates will likely continue. So here is the calm recap. 1. Lawmakers have introduced a bill that would exempt healthcare workers from the new $100,000 H-1B fee. 2. The biggest impact would likely be on physicians, hospitals, and other health systems that depend on international talent. 3. This is not final yet. 4. Anyone affected should monitor official updates and keep documents ready. 5. Do not panic, but do stay alert, because the details can change quickly. If you want clear updates like this as the story develops, make sure you subscribe and turn on notifications so you do not miss the next step in the H-1B debate.